has gloves, I have the suction kit. And we have a suction and we have a bag. What else do we need? Nothing else. We do all that stuff, identify the patient, talk to the patient, check red sounds. If the patient has a nail drip, maybe we want to stop it. We don't want the patient to start throwing up, all that stuff. I'm going into the technique of suction. One of the things that we do when we suction an airway, and this in this case is the tracheostomy, we suction what else besides secretions? If I put a suction in your stomach, I suction what?
Gastric,
And what else?
acid juices,
What is it?
mucosa,
What is, no, because it is suction.
nothing else?
What is,
I don't know what comes out of that.
two purposes for putting gastric tube, air. So if I suction the lung, what I'm gonna suction? Besides secretions? Air. So remember, every time you suction, the patient is gonna be short of breath because we are suctioning the air, we are suctioning the oxygen, we suction everything besides the secretions. So we're gonna suction forever. We limit the suction to 5-10 seconds, okay? 5-10 seconds. No more than 5-10 seconds. You get used to the 5-10 seconds, and then the patient needs to recover because you are suctioning everything that is in the lung. And you know the air comes out pretty fast. You put the suction, the air comes out really fast. So, before doing that, I have my suction, I verify I have suction. The suction has to be between 100 and 120 millimeters of mercury on the suction gauge. Gauge? Good, I'd say it right. Usually it's the green area. The green area is normal. What happens sometimes, and this is all dirty. If this is all dirty, sometimes normal suctioning doesn't do it, so you need to increase the suction because you don't feel here anything. It's not suctioning anything. Once you get used to it, you will get used to how much is a normal suction, okay, on your finger. You need to have oxygen. You need to have a...
Did you say this was dirty?
Yeah, that's it.
Like on the
Inside.
inside?
Yeah,
So
maybe
when
On
you
the
there's...
get a
inside, it
new
may
one?
be,
Yeah, but you change it once a day. You're gonna change it
Okay.
every 2 minutes.
Yes,
So
so
sometimes
if you're
gets
being sectioned on a regular basis.
yeah,
it's
some
good.
patients you're suction every hour or so. So you have so many secretions. So this gets kind of clogged somewhere, okay? But you see the things hanging there.
right there.
Thick stuff hanging there. So you may need more suction.
And their
because
food comes out too, when you suction.
food from the lungs.
No, some yellow food, whatever was left over in his mouth that didn't really get,
If you suction them out,
Not
you
if
may-
you-
no, when you suction in the mouth, some other stuff, I mean,
Oh.
we had chunks of,
Oh, yeah,
that
in the
didn't
mouth.
look like,
some would, not
Yeah,
like
that's
some.
what you're sectioning.
so, but this one you're gonna suction here, right?
No, we're
No,
gonna
it's
suction.
gonna be on
No, we're gonna put
Here,
a catheter
so you
in the
don't-
trach.
But what, that tube is the one that you suction in the mouth,
Yeah,
with that tube?
with this young power tube, we suction them out.
Yeah, see, all that
Because
other
you can
stuff
pick up
comes out.
bigger-
See, it has a
chunks.
hole?
Yeah.
This is permanently suctioning. If you put it here, it's gonna suction air from here. The moment you close here, it's gonna start suctioning from here. Make sense? If this is like this, I put in the mouth, it's gonna suction air from here. The moment I start occluding, start suctioning from here. Okay? Okay, so now, I'm gonna suction the tracheostomy. Because I'm gonna deprive the patient from oxygen, what I do is I just blow oxygen on the patient. I may have a helper to do that. On some patients that are on Lumea, it's not necessary to hyperventilate the patient to give extra oxygen. But if you do, you're going to be using a dirty hand, like with a Foley catheter, a dirty hand and a clean hand. And for me to be a little bit more appropriate, I better go on the other side. Because this is my dominant hand, and this is going to be my clean hand, okay? This is going to be my dirty hand. So if I have to grab the ambu bag to give oxygen to the patient, I use my non-dominant dirty hand, okay? I'm going to have gloves. And every time I'm going to remove, I always hold the tracheostomy. It's not the first time that you do like this and everything comes out. Because this thing has secretions, it's kind of sticky. So you do like this, okay. But let me show you, and never put things on top of a patient, but sometimes, no. Or you may have somebody who helps. Okay. I'm gonna have this thing. I put on my gloves without touching the catheter, okay? Put on my gloves. Do you think I will be successful putting on my gloves?
Absolutely.
We never put things on top of a patient, I just said it, no?
Yes. Yeah, but we don't have it.
Terrible.
Yeah, how am I gonna put this thing
Too small.
It's too small for you.
Yeah, it's that size small.
Ooh.
Where is this?
Yeah.
Oh, this is latex. Let's see how successful I am this thing.
Much
Those
Smaller.
look about as good as the other ones.
I think they're gonna be too small.
You're gonna contaminate your gloves.
What size are you?
I think if he knew that, he'd have been successful the second time.
And I don't have that large ones, but,
Well, those are kind of glued together.
These are older than my mother, so they're gonna break. I'm just telling you.
Yeah, those are big. Oh, those are,
Yeah, very old. They're gonna break. This is latex from the 40s. I don't know.
oh, wow.